Hi, my name is Kathy Jones. I'm a GP, and I'm here today to answer some common questions asked about cervical screening. What is cervical screening and why is it so important? Commonly known as a smear test. Cervical screening is not a test for cancer. It's a test that prevents cancer. It's a test that picks up some cells from around the cervix and looks to see if they're healthy. And also it looks to see for an HPV virus. This is a human papillomavirus, and it's very common in everybody. It's very important that a woman has a smear regularly to look for these changes so that they can be treated and prevent her getting cancer. It's a very short test that only takes about 5 minutes, and it can change your life. How old do you have to be to have a smear? In the UK, everybody registered as a woman with their GP will be invited for a smear a couple of weeks before their 25th birthday. And these invitations will go on at regular intervals right up until they're 64. Who performs these smears, these cervical screening tests? It'll be a nurse or a GP in the practice where you're registered, or in some areas there are special health clinics that will do this for you. Whoever does it will be well trained in the procedure and will be doing it very often, very regularly, and will make sure that there is nothing to worry about for you during the procedure. Is it uncomfortable to have a smear? Is it painful, you might ask? Well, it certainly should not be painful. You do need to remember that you'll be in control, you're there, you're talking to the person doing it, you can stop it at any time. There are many things they can do to make sure that it is not painful for you. Do I need to do anything in preparation? You don't need to do anything in preparation. What we do ask is that you work out when your period is due and you try to book the smear at least a couple of days before the period is due and after a couple of days when the period will have stopped. It would be good that you don't use any lubricants or any creams inside your vagina a couple of days before the smear as well. I hear a lot about HPV, but I'm not sure I really understand what it is. HPV stands for human papillomavirus, just one of the millions of viruses that we human beings have on us and in us. It's spread by close bodily contact. So obviously sexual relations, very much so, is a common way in which this is spread between two people. It's been found that HPV is very closely linked with the development of cervical cancer, and that's why the smear is looking for cases of HPV. HPV causes the cells around the cervix to change, with the potential of them actually then becoming cancer. 99.8% of cervical cancer is actually linked with HPV, so cervical cancer is preventable. Do you need to have cervical screening if you had the HPV vaccine? The answer is definitely yes. There are some variants of HPV that are not eradicated with the vaccine and are still linked with cervical cancer. So we strongly recommend that even if you've had the vaccine, you still respond to the invitation to go and have a smear done. Do I need to have a smear if I'm not sexually active? If you're not sexually active, it is very unlikely that you will get cervical cancer. So we leave the decision to you as to whether you would like to have a cervical smear from the age of 25 on or not. If you're not sure about this, then please do come and discuss it with your GP or the nurse running the smear clinics. What happens after your cervical screening appointment? In nearly all areas, you will receive a letter in the post within 2 weeks of you having the test. So you will then have that great relief that you are not at risk of developing cervical cancer, or if HPV has been found, that you will then be referred on for further tests. Cervical screening saves lives. There is no doubt about that fact. So please respond to the invitation you get from your GP surgery to book your smear. Cervical screening stops cancer before it starts.